Suicide.
Mm-hmm.
I know a couple of people that you have treated who were suicidal, in my humble opinion. Big depression, severe depression. What do you do for that? What happens?
Well,
Can
again,
you look at a brain map and tell that somebody is suicidal?
no, but I can tell they're seriously depressed.
Okay.
And that's what we're looking for. We do a brain assessment, and we're looking for what kind of depression we're dealing with. There are many, many different forms of depression. Then we look to see if they have a trauma marker. I'm talking about an emotional trauma now. An individual who has experienced something that is a severe emotional trauma. When you see that kind of combination, and there are some other things in the frontal cortex, then one of the things that's always a concern is suicidality. And we're very straightforward with, as you know, I just go through the brain assessment, and I'm very straightforward with individuals. And if I'm concerned about suicidality, then we deal with that as part of the treatment. The area of particular concern is adolescence, because it's the #1 killer of adolescents, as you probably know.
Well, I know at least 20 people whose sons or daughters have committed suicide, including one of my cousins.
So whenever we see this in a young child, all of the flags go up, and we take all kinds of precautions associated with it. It's a complex issue. One of the things that we're always concerned about is when you have a severely depressed person and they start to feel better, they go through a higher risk of suicidality.
Oh, really?
It's the coming up problem, as we call it. And you have to watch to just see how they're presenting themselves, and the way that they're dealing with their therapy. So there are a lot of issues associated with this.
That would be very much what I heard on the air a couple of nights ago about Marie Osmond's son, Michael.
Bingo.
Killing himself. They were talking about how happy he was 2 weeks ago.
Yes.
And how unexpected to them.
Mm-hmm.
This was other people that knew them, people of Entertainment Tonight and so on, because he was apparently on the show 2 weeks ago.
Could well have been what we call a coming up problem.
Really?
Yeah. Well, there are all kinds of theories about why that occurs, that they suddenly feel empowered, that they have the motivation to do it, where if they're severely depressed, oddly enough, they're not motivated enough to carry it out.
Well, that's an interesting, I understand, I can actually understand that.
Yeah.
If you feel good about everything and you're fed up with everything else, you might just as well go off the balcony.
That's right.
Because Art Linklaters, I'm not going to bother going on and on and on. I want to do, if there's something you want to bring up, what is the subject tomorrow night? Because you always have sort of a focus.
It's a general introduction to neurotherapy.
Just a general, so
we go through autism and Asperger's and ADD and depression, closed head injury, epilepsy, as much as we can shove into an hour and 20 minutes.
I remember when I first talked to you, I mean, ADD was ADD. And you said, no, there's like 11 kinds. How many kinds are there?
Well,
have you discovered some more?
things that you would hang that label on, there are probably 11 different varieties, but there are a lot of things that will interfere with a child's ability to pay attention. And this is what really irritates me about the use of these labels. We have a lot of conditions in which the child shows a trauma marker. And it turns out, for example, a child's being seriously bullied and frightened to tell his parents about it. The kid's terrified. Of course he can't pay attention, and retain information and so forth. And then we go through all the silliness of putting a label on it and medicating the child. I mean, it's absolutely idiotic.
So, well, I recently talked to one of your patients who is bringing up trauma with their mother, or beatings, misuse or abuse, whatever you want to call it. You don't do things like regression, do you? You find the signature in the brainwave that tells you, because you've got what, $400,000 brainwaves on record, or 400,000 brainwaves, or how many have you got on record now? I think it was
thousands and thousands and thousands. Yes.
Yeah. But you've got these brainwave patterns that tell you that a person in this kind of a situation has that kind of thing wrong with their brain. Is that what you're telling? Is that what you do, or how does?
It's the most efficient psychotherapy on the planet, because what you're doing is you're releasing the trauma. And what happens is when you release the brainwave signature that's associated with the trauma, the individual dreams more about it. It's on the front burner for a while. They process some emotional content.
They can think
We might do a little counseling with them. We have a couple of techniques that we use to help them deal with that. And sometimes it's 2 or 3 sessions, and that's the end of it. And the nice thing is we don't have to be nosy therapists.
Yeah.
I mean, the person may process all of it themselves.
They can do it themselves.
Yeah.
Well, the email, I was going to print it out so I could read it out to you, because the email I got was that this lady had felt that 90% of her chronic fatigue syndrome was gone. And
this is one of our clients?
Yes.
Oh,
and 60% of her fibromyalgia was gone. And she was sleeping like she couldn't believe. It was really good. And then that some deep trauma stuff was getting dealt with as well.
Yeah.
And I want to go a little bit longer, Richard, if we can, okay?
One of the principal...
I can keep you for a few minutes longer.
Oh, yeah.
Okay.
One of the principal causes of fibromyalgia is trauma, emotional trauma.
Yeah. And you've always told me that you can cure that. Sometimes,
you keep using the term cure.
Well, because that's what I hear all the time, because everybody else... I'm embarrassed. I've taken 2 psychologists down to Paul's place psychologists I respect and like. One in particular was an ADD person, and I thought they would sort of jump in with both feet and be part of this, and they're not. And I've talked to psychologists all over the place, and I told you about being out at the Colony Farms and mentioning you and what you're doing to one of their psychologists. I won't identify him because maybe it's all, I don't know. I was so disgusted because I brought what you do up, which I know to be effective, and I've got so many. It's not like 1 or 2 or 3. If there was only a dozen people, I wouldn't be so enthusiastic. It's like hundreds. You don't really know how many people I've sent you, because they don't walk in with a sign saying, but they go. And because it's like almost every family's got somebody that can use some help from you. I've sent husbands, wives, daughters, mothers, fathers, brothers, sisters. I've sent everybody to you, because I've been doing this I've known you for 12 years now. And I talked to dozens of people, like Stephanie. There's a couple of people a week anyway. Whether they all go and see you, I don't know, but they tell me. Anyway, I lost track of where I was. I'm just in so much admiration. You cure, you fix them. With one exception, everybody has said that you did them good. And the guy that did you good, his sister thinks you did that doesn't think you did him any good, his sister thinks you did wonderful. And again, just for the record, the fellow that, he was, I think, 54 when he first went to see Paul. And he never had a job and never had a girlfriend. Never had a full-time job, never had a full-time girlfriend. And one of the problems is, if you're 54 and you've never had a girlfriend, never had a job, and that's what you want, I don't care what you do, you can't make that happen, because I don't have a girlfriend right now, and I've had 7 wives. So, I mean... Do you know what I mean? It just doesn't. They just don't fall in. I got lady friends, but I don't have a girlfriend. So, and if you're 50
you're cured.
If you're 50 years old, I'm cured. Everybody's laughing and shaking their head, laughing their head, clapping their hands.